people here or 300 people here, I know the impact of what you do every day. So my name is Dr. Hlatshwayo Davis. I'm your health director for this beautiful city. And this work is near and dear to my heart because I'm an infectious diseases doctor by training. I subspecialize in the care of people living with HIV. So before I became the health director, I actually had a clinic at Washington University for people living with HIV, and I had an STI clinic, and I had the same. I was the lead HIV clinician at the John Cochran VA. So this work is really my life's work. Like, I shouldn't have favorites now that I'm the health director over what I love, but this right here is my life's work. So I do want to thank Novus Health, and specifically you, Dale Wrigley, for your leadership and for the opportunity to bring awareness to PrEP. You know, we should have ended the HIV epidemic ages ago. We're the United States, world's biggest superpower. I always say we recognized HIV in 1985, but I'm pretty sure it was already before that, right? And we're in 2023. What are we even talking about, right? And so this week to me is so important because PrEP is one of the single most important innovations of the entire HIV epidemic since its impetus. The ability to right now have adults who should enjoy their sexual health to its fullness, let's be clear, as long as they're consenting adults, right? And it's done so in a safe manner, is so important, right? And to have now a pill option and an injectable option for folks to do that, preserving their dignity, destigmatizing this approach, to me is so important. So I'm so proud of the work of this PrEP week. I know he's exhausted. I know you're all exhausted because you've been so into this all week. So I want to thank you for bringing awareness and, most importantly, inclusivity. Anyone who knows me knows I'm unapologetic about leading on health equity for Black and Brown communities who historically and presently have been marginalized, disenfranchised, and left behind. And so the work of Novus Health, the fact that you are exactly where people can get to, that you're accessible, that you're visible, and that you're willing to partner with local health departments means a lot to me. So I want to thank you for your leadership there. Novus is working to provide patient-centered, equitable access to primary care, and that's exactly what we need right now. Linking patients to exactly what they need and doing so in a way that gives them that dignity and makes them feel seen. So I want to just honor your work. I'm really excited about the new building in January. If I don't get an invitation, I'm going to gate crash. So we don't want a lady with a proclamation to gate crash, okay? So thank you for the work of health equity in action that you do every day. So I'm going to read this proclamation that I bring to you by our Honorable Mayor Tashara Jones, who brings her apologies for not being able to be here today. She's actually sick, so I'm actually filling in for her all weekend, which are tough shoes to fill until she's back on the mend. And so these are the words that Mayor Tashara Jones and her office send to you today. Our Honorable Mayor Tashara Jones says, I want to thank Novus Health and its Executive Director, Dale Wrigley, for the opportunity to bring this awareness and inclusivity. This proclamation that you'll be able to display wherever you so desire reads as follows. Whereas the City of St. Louis Department of Health maintains its role as a community advocate and champion of health equity and has campaigned for the awareness of HIV and its impacts on the city and promotes strategies to prevent its spread. And whereas more St. Louisans are living longer lives with HIV and biomedical innovation and has led to more effective prevention measures such as pre-exposure prophylaxis for PrEP. And whereas ending the HIV epidemic, an initiative launched by the U.S. Department of Health and Human Services in 2019 aims to reduce new infections in the U.S. by 90% by the year 2030. We recognize this is accomplished by advancing health equity and normalizing innovative prevention methods such as increasing community-wide uptake of PrEP among persons not living with HIV. And whereas the CDC has stated that HIV affects all races and ethnicities in the United States, yet Black African or African American, Hispanics or Latinx and youth are disproportionately affected by HIV, indicating that more work is needed to ensure PrEP is accessible across all ethnicities. And it's a long one. Stick with me now. Whereas in 2022, the City of St. Louis Department of Health recognized the last full week in October as PrEP Week. to raise awareness of PrEP and how it prevents new HIV infections to end the HIV epidemic. And whereas the City of St. Louis Department of Health has again set aside the last week of October to promote the uptake of PrEP, now therefore, I, Tashara O. Jones, Mayor of the City of St. Louis, do hereby proclaim the last full week of October 2023, which is October 22 to October 28, as PrEP Week in the City of St. Louis, in witness whereof I have hereunto set my hand and caused to be affixed the seal of the City of St. Louis this 22nd day of October, AD 2023. Thank you. That was so nice. Y'all really hung in there and tried to look engaged.